Hi guys, it's your next door nurse Florence and you're welcome again to my channel where we talk all about emergency health and wellness tips. In today's video, we're going to be looking at the topic menopause. We're going to be talking about its definition, its signs and symptoms, talk about its causes, the stages. Stick with me. Menopause is the stage of life that follows the end of the menstrual cycle. It's a natural process that occurs as the ovaries age and produce less reproductive hormones. Each person may experience menopause differently, and it can last for several years. Menopause is not a health problem. Some women experience it as a time of liberation. In menopause, the body undergoes several changes in response to lower levels of estrogen, progesterone, follicle-stimulating hormone, and luteinizing hormone. One of the most notable changes is the loss of active ovarian follicles. Ovarian follicles are the structures that produce and release eggs from the ovary wall, allowing menstruation and fertility. Menopause usually starts between the ages of 40 and 58 years. Most women first notice the frequency of their period becoming less consistent as the flow becomes heavier and longer. For some, menopause can be induced or caused by injury or surgical removal of the ovaries and related pelvic structures. Common causes of induced menopause include 1. Bilateral oophorectomy or surgical removal of the ovaries. 2. Pelvic radiation. 3. Pelvic injuries that severely damage or destroy the ovaries. 4. Shutdown of ovary function, which may be done by hormone therapy, surgery, or radiotherapy techniques in women with estrogen receptor positive tumors. There are 3 stages: the perimenopause, the menopause, and the postmenopause. Perimenopause is a transitional time that starts between menopause and includes the 12 months that follow a person's last period. Menopause starts either 12 months after the last period or when menstruation has stopped for a clinical reason, such as the removal of the ovaries. Postmenopause refers to the years after menopause, although it can be difficult to know when menopause finished and postmenopause starts. In the months or years leading up to menopause, you might experience these signs and symptoms: irregular periods or less frequent menstruation, vaginal dryness, depression, anxiety, hot flashes, painful or stiff joints, reduced sex drive, chills, sleep problems or insomnia, mood changes, reduced libido, night sweats, difficulty concentrating, urinary tract infection, increased urination, thinning hair, dry skin, mouth and eyes, loss of breast fullness, sore or tender breasts, headaches, racing heart, weight gain, and slowed metabolism. Changes in menstruation can vary among women. Most likely, you will experience some irregularity in your periods before they end. Skipping periods during perimenopause is common and expected. Often, menstrual periods may skip a month and return, or skip several months and then start monthly cycles again for a few months. Periods tend to happen on shorter cycles, so they are closer together. Despite irregular periods, pregnancy is possible. So if you have skipped a period but aren't sure you have started the menopausal transition, consider a pregnancy test. You should seek medical help if you have bleeding from your vagina after intercourse. So guys, we've come to the end of this topic. If you find it helpful and useful, give me a thumbs up by clicking on the like button. Please subscribe for free by clicking on the red subscribe button. Also click on the notification bell so you'll be the first to know when I upload new videos. You can drop your comments or questions in the comment section below and I will attend to them. I'm still your next door nurse and I'm just a knock away. I love you guys. Bye for now.